Hello everyone, my name is Aisha Salar and I'm a Master of Public Health student and a Center of Excellence in Maternal and Child Health Scholar at University of South Florida. Today my poster's topic is Siblings Birth Defect Recurrence in Florida. According to the US Census Bureau, the average American family had more than one child in 2019. Pregnancy outcomes should be used to inform family planning and risk factor reduction for subsequent pregnancies, especially in regard to birth defects. Birth defects are the leading cause of death for children under 1 year of age and can adversely affect the quality of a child and his or her family's life by requiring costly medical treatments, therapies, or educational intervention and may limit a family's availability for employment. It is therefore important to make available relevant up-to-date estimate of sibling recurrence risk to provide evidence for families to make clinically informed decisions based on the risk of recurrence. Previously, studies have reported an increased risk of birth defects among infants with an older sibling that had a birth defect, especially if the birth defect was an orofacial or a neural tube defect. However, the literature on sibling recurrence risk for major birth defect is limited, and in particular, there is an absence of population-based estimates of recurrence risk in the United States. To fill this void, the study sought to quantify reliable estimate of defect-specific sibling recurrence risk and be among the first to differentiate between concordant and discordant recurrence risk using a large Florida statewide population of children with siblings between the years 1998 and 2013. The data for this study were obtained from three primary data sources: the Florida Birth Defects Registry, inpatient hospital discharge data, and birth certificates. Siblings were identified using a unique maternal identification number and were grouped into sibling pairs for analysis using combination pairing method. For the data analysis, descriptive statistics were used to assess the study population, and frequency and chi-square tests were compared to and computed to compare the socio-demographic and perinatal characteristics of infants by the presence or absence of birth defects within the same characteristic level. Following the population assessment, sibling pairs were grouped and used as analytical units. Crude and adjusted relative risk ratios and 95% confidence interval were estimated using logistic regression, representing the association between the predictor older sibling birth defect variable and the birth defect outcome variable of interest in the younger sibling. Stepwise model selection was used to select the adjustment variables: birth year, maternal age, maternal education, maternal pre-pregnancy BMI, maternal race and ethnicity, maternal gestational diabetic status in adjusted models. Overall, nearly twice as many younger siblings presented with a birth defect when the older sibling had a birth defect. This equated to an adjusted overall sibling relative risk ratio of 2.0. When analysis was delineated to body region specific categories of birth defects, all groupings except for chromosomal and gastrointestinal conditions showed significantly increased adjusted relative risk ratios ranging from a 60% increased likelihood for musculoskeletal conditions to a 120% increased recurrence risk for central nervous system conditions. In the analysis where sibling pairs where discordant defects were excluded and concordant birth defect risk was assessed, all body region birth defect groupings showed a significant concordant adjusted relative risk ratio ranging from 2.6-fold increased likelihood of a younger sibling presenting with a cardiovascular condition if the older sibling had a cardiovascular condition to a 17.6-fold increase concordant sibling likelihood of an orofacial condition. Our study findings support a direct association of birth defect recurrence. Infants whose older siblings have a birth defect are at an increased risk of also being born with a birth defect. The findings of this study highlight the importance of assessing sibling recurrence by specific birth defect categories, and future studies should examine paternally linked data and include longitudinal follow-up for conclusions on life course outcomes. Recurrent studies like this one provide evidence for the need of crucial interventions that may help families reduce the risk of subsequent birth defect outcomes. It is imperative that we need to aid families in seeking resources and services early, even before the next perinatal period, for the best life outcomes for their children. Thank you.